Future directions and challenges. Addressing global disparities in fertility care. Addressing global disparities in fertility care is an increasingly important focus in reproductive medicine. As fertility treatments and assisted reproductive technologies (RT) advance, there is a growing need to ensure equitable access to these services across different regions and socioeconomic groups. Globally, fertility care remains a highly specialized and expensive area of medicine, with significant disparities in availability, affordability, and quality of care. The future directions in addressing these disparities aim to improve access to fertility care, reduce barriers, and create a more equitable global landscape for those seeking reproductive healthcare. Below is a detailed exploration of the future directions and challenges in addressing global disparities in fertility care. 1. Current state of fertility care and global disparities. Fertility care is heavily influenced by several factors, including geographical location, economic status, and cultural norms. Disparities in fertility care manifest in a variety of ways. A. Geographic disparities. Developed countries versus developing countries. In high-income countries, ART services such as IVF, egg, sperm freezing, and pre-implantation genetic testing, PGT, are widely available. However, in low and middle-income countries, access to such services is limited, both in terms of availability and affordability. Urban versus rural access. Even within developed countries, people living in rural areas often have limited access to fertility clinics, with ART centers typically concentrated in large urban centers. B. Economic barriers. Cost of fertility treatments. ART procedures are often prohibitively expensive, especially in countries where fertility treatments are not covered by insurance. The high cost of IVF, medications, and other fertility treatments is a significant barrier to access, particularly in low-income populations. Lack of insurance coverage. In many regions, fertility treatments are not covered by public or private health insurance, leaving many individuals unable to afford these services, especially in developing countries. C. Socio-cultural barriers. Cultural norms and stigma. In some cultures, infertility remains a taboo topic, and individuals seeking fertility treatment may face social stigma or discrimination. These cultural attitudes can prevent individuals from accessing needed care. Gender roles and reproductive rights. In some societies, women may face more significant barriers to accessing fertility care due to gender-based discrimination or restrictive policies around reproductive rights. 2. Future directions in addressing global disparities in fertility care. The future of fertility care must prioritize reducing global disparities by improving access, affordability, and the quality of care worldwide. Here are several key directions for addressing these disparities. A. Increasing access to fertility treatments globally. Expanding RT clinics to low and middle-income countries. One way to address disparities is to establish RT centers in low-income and middle-income countries. This could involve partnerships between international organizations, governments, and non-profit organizations to create regional hubs for fertility care. Mobile and telemedicine solutions. Mobile fertility clinics and telemedicine services could bring fertility consultations, diagnosis, and even some aspects of treatment, like hormone monitoring, to underserved regions. By leveraging technology, reproductive health services can be made more accessible to rural and remote populations. Public-private partnerships. Governments and private entities can collaborate to build infrastructure for fertility clinics in underserved regions. These partnerships can help offset costs, making fertility care more accessible to those who otherwise couldn't afford it. B. Reducing the cost of fertility care. Subsidized or universal coverage for fertility treatments. One of the most effective ways to address the economic barriers to fertility care is to provide subsidies or insurance coverage for ART services. Some countries already provide public funding for fertility treatments, and expanding this coverage could help ensure that more people can access ART. Reducing the cost of medications. Fertility medications, such as those used for ovarian stimulation in IVF, are often expensive. Efforts to reduce the cost of these medications through generic alternatives, international collaborations, or government subsidies could make ART more affordable. Innovative financing models. In regions where ART is expensive, innovative financing models such as fertility loans or financing through microcredit programs could provide individuals with more affordable ways to access treatment. C. Education and awareness campaigns. Public education on fertility health. Increasing public awareness about fertility health and treatment options, especially in low-income areas, can help reduce stigma and encourage people to seek care. This can be achieved through campaigns in schools, hospitals, and through social media. Training healthcare providers in fertility care. Training primary healthcare providers to recognize fertility issues and refer patients to specialists could help bridge the gap between early detection and treatment. Additionally, healthcare providers can be trained to address the socio-cultural factors that might prevent individuals from seeking care. Community outreach programs. In many developing countries, people are unaware of fertility treatment options. Community outreach initiatives, especially in rural areas, can help educate people on available fertility services and how to access them. D. Promoting research on affordable and effective fertility treatments. Research on cost-effective alternatives. Research should focus on developing cost-effective alternatives to expensive ART procedures. For instance, simpler and less expensive fertility treatment protocols that are still effective could be developed for use in low-resource settings. Improved technologies for remote monitoring. Investment in technologies that allow for remote monitoring of fertility treatments, e.g., hormone levels, can reduce the need for frequent clinic visits, thus lowering costs and making treatment more accessible. Innovations in genetic screening. Developing more affordable genetic screening methods, especially for identifying inherited diseases and chromosomal abnormalities, can help lower the cost of treatments like IVF with PGT. 3. Challenges in addressing global disparities in fertility care. While there are many promising future directions, several significant challenges remain. A. Cultural and social challenges. Stigma around infertility. In many cultures, infertility is a highly stigmatized condition. Women, in particular, may face significant social pressure or blame if they are unable to conceive. This can discourage people from seeking treatment and prevent widespread adoption of fertility care services. Gender-based barriers. In some countries, women may be the primary focus of fertility treatments, but societal norms may limit their access to these services. In these regions, the focus may need to shift toward ensuring that men also have access to fertility testing and treatment. B. Political and legal barriers. Restrictive reproductive laws. In some countries, strict laws govern reproductive health care, limiting access to fertility treatments. These laws may ban certain ART procedures, such as surrogacy, or impose restrictions on the use of donor gametes, eggs, or sperm. Lack of regulation and oversight. In many developing countries, the fertility care industry is not regulated, leading to potential exploitation of vulnerable populations. Ensuring that fertility clinics meet appropriate standards of care is essential to reduce harm and improve patient outcomes. C. Resource limitations. Lack of skilled professionals. In some regions, there is a shortage of trained fertility specialists and embryologists. This gap in expertise needs to be addressed through education and training programs to meet the growing demand for fertility services. Infrastructure challenges. Even in countries with access to ART, some regions lack the necessary infrastructure, such as reliable electricity, clean water, and medical equipment to safely administer treatments. 4. Conclusion. Moving forward, addressing global disparities in fertility care requires a multifaceted approach that combines increased access, reduced costs, educational outreach, and innovative research. The future directions outlined above represent potential solutions, but overcoming the challenges will require collaboration across governments, international organizations, healthcare providers, and the private sector. Ultimately, the goal is to ensure that individuals around the world, regardless of their economic or geographic status, have access to the fertility care they need to achieve their reproductive goals. Reducing disparities in fertility care will not only improve reproductive health, but will also contribute to health equity, ensuring that everyone has the opportunity to build families and fulfill their reproductive aspirations.